It's Wakanda.
Good evening, my brothers and sisters, ladies and gentlemen. Let's talk about a few things this evening or today, whenever that you decide to listen to this podcast. So first off, thank you for being here. It's always a pleasure having you here. And I'm always honored to be able to speak to you. So let's get started with a few things. So first off, let's talk about staffing within healthcare, which I know staffing is not unique to healthcare. I know staffing has been an issue primarily since COVID. Some places staffing is better, some places worse. I think we're all pretty familiar with that. However, I do want to talk about why hospitals, long-term care facilities, etc., are turning away staff. People are applying at different places and they're either not getting a call back, they are being misinformed, or flat out lied to about staffing. So you may see a job posted. You may see it on their website. You may see a social media post. You may have a recruiter reach out to you. And it says that there's an availability at this particular place for this particular rate of pay on this particular unit. However, when they go apply and they go through the whole application process, right? They never hear anything back. They don't hear a single word. Why is that? It's because they have been severely misinformed. And it's really unfortunate, to be completely honest with you, because there's plenty of staff that will flat out come out and tell you that they need help. And their manager will tell them, people just aren't applying, or we're really trying. And you may have upper management. You may have CEOs that are going to not hire people because they feel like they can do more with less. It's true. It's sad. It's pathetic. But that's the truth of the matter is they feel like they get more profit out of people doing more with less. So you have that going on, and it's unfortunate because it's a whole trickle down effect, because you're going to have staff that are going to be burnt out. You're going to have patients not getting the proper care. And then you have this vicious cycle that just goes on and on and on and on and on and on and on. And then that's not even counting, people who aren't new grads, who maybe they want to change departments, and then they can't get on. They can't get on, so sometimes you have the new hire bias. No shade to my new grads listening to the podcast. I hope you do well. But those who have been in healthcare a while, they'll tell you, like, they can't get on anywhere else. Like, they have to stay within that department or that specialty, because nobody else will hire them. And it's quite sad. So you have all that going on. Won't hire, a lot of bias, can do more with less, and people being flat out lied to. And then that's not counting hospitals or long-term care facilities that will literally hire agency, right? Hire agency or travel nurses or travel staff that will bring them on. They sign a contract, right? 12 weeks, whatever. And then they'll let them go before their contract is over. They'll just let them go. They'll say you're no longer needed. And they'll leave that facility short-staffed. And it's because upper management's telling, like, hey, we can't afford to pay these people. They can. And so you need to let them go. And then it's like, wait a minute, you want me to let them go and we have nobody to replace them? I'll say yes, and then they'll let them go. I have been part of the staff that has had to work shorthanded because hospital wanted to make budget cuts. Please don't do that. If you're listening to this, you're some CEO of some hospital or whatever, please stop doing that. Or please find a better solution to please back your staff. Because you know how we feel? Like when you just go home, you're sleeping comfortably in your bed, you're sleeping comfortably with a clear conscience, and the rest of us are just struggling. It's not cool. We're struggling and we're tired. So I hope you know, if you're a CEO or anybody listening to this, please stop doing that to your staff. Your patients are suffering and they're coming to your place hoping to get great care when you are neglecting them from above. So I hope this reaches the right audience, because that is unacceptable in my book. And we can talk a lot longer on hospital staffing, because there's plenty going on with that. And there's plenty of nurses and CNAs, etc. People will tell you how bad it is when they have to work shorthanded. It's a huge trickle-down effect. But we can touch more on that another day. Let's talk about a CNA nurses station sign. Okay. So recently there's a video that's been circling around about a CNA that posted a sign that said CNAs are not allowed at the nurses station. This sparked a lot of controversy. I had posted a video about it, and I talked about it, so we're going to talk about it a little bit further. For those who are non-medical watching this or hearing this, a CNA is a certified nurse's assistant. Okay, they spend hours within a classroom learning basic skills, such as learning how to bathe somebody, learning how to turn somebody, change somebody, and a few other skills that they can add as well. Okay, and then they become certified. So you have a CNA, and then, so of course we know what nursing is, like a licensed practical nurse, or maybe a registered nurse for those who are not aware. So anyway, in a long-term care facility, you can have, both, but I'm not sure what particular staffing is at this particular nursing home. However, in my experience working in nursing homes or long-term care facilities, I will say that I have not physically seen a sign, but I have had management tell CNAs not to sit at the nursing station. And their reasoning was, which is old school, their reasoning was, if people are walking by and they're just seeing you sitting down, are you really working? Are you really working? And so, you have that going on. And then also, you also have where it's just a misconception. It's just where people are just believing that CNAs, if they're sitting down, they're not working. And that's entirely not true. And then, so some of the comments, let's talk about some of the comments I've seen. Some people who have been disrespectful towards CNAs, they have come out and flat out spewed hate towards CNAs, which I think is unacceptable. I saw a comment where somebody said that, they're lazy and, they can't find them, and a bunch of slander that doesn't need to be said on social media or any media platform. I would say if you personally are not getting along with your CNAs, that's a you problem. That is a you problem. You need to get on their level to learn how to speak to them as human beings, and that way they can respect you, because maybe they don't respect you. The person that said that comment, let's be honest, they may not respect you at all. You may not help answer call lights. You may not help change patients. You may not help do anything, and yet you're barking all these commands and expecting them to just do whatever that you say. So maybe if you get on their level, talk to them like human beings, maybe they'll respect you, and maybe they'll listen to you more. But I saw something about HIPAA. I'm like, bro, come on now. The HIPAA excuses is wild to me. The only time where I believe CNAs should just get up is if a nurse has nowhere else to chart and that's their primary place to chart, and a CNA needs to get up and let the nurse chart, and or a doctor. But if there's enough seats, they should not be excluded. They should be able to sit there. I've had some people comment that they stand for 12 hours. That's crazy. They have the kiosk, or a place where they can chart. It's on the wall. Or they have a cow, a computer on wheels, where they'll chart. But they're not allowed to sit at the nurse's station. I had people flat out tell me that this can't be true. Or this doesn't exist. Yes, it does exist. This sign does exist. I promise you it exists. There's many people that can vouch for it. You can choose to believe it or not. It's up to you, but it does exist. So you have that going on. And it's unfortunate. I feel like going into 2025 that we shouldn't have these things. It's outdated. I just talked about nursing staff, and right, it's hard to keep staff. You think that's a good way to promote staff to want to be there in that type of environment? I think not. I don't think so. So let's not do that. Let's try to get better with that. We don't need signs prohibiting people that they can't sit. I mean, people have talked about they work in places where nobody can sit. That's crazy to me too. There's nobody can sit. Nurses can't sit, CNAs can't sit, nobody can sit but the doctors. So we don't need that. We need less of that. We need more unity within healthcare, flat out. If we're going to survive, if we're going to get better, if we're going to have more people within this profession, then we're going to need CNAs. So that's the end of that. We need CNAs. Love you guys. Love my nurses too. All right. So, this subject I want to talk about real quick is a congresswoman in a nursing home. Now, this congresswoman was a representative out of Texas, my understanding. And she was a sitting member of Congress, was getting paid as well. She was getting paid as a member of Congress. But she was in a nursing home. Not only was she in a nursing home, she had dementia as well. So a congresswoman that was getting paid but was not performing her active duties, did not resign, but was in a nursing home. I would like to say this did not happen. I would like to say this is made up, but apparently it's not made up. It's not made up. And she held an important position in Congress as well. And really, I don't know. Sometimes American politics is like a big movie. You never know what's going on. You never know what's going to happen. You never know. Because to be perfectly honest, over the last few years, even recently, it just feels like a big movie, right? And I'm saying this out of respect. We had the CEO that had his life taken, by Luigi, which I'm not here to really go into that. But we had that happen, and the American public spoke on that, right? They had their thoughts, their feelings on that. And just before that, we also had, President Trump that's, has John F. Kennedy and Dr. Oz in certain positions, in his cabinet or whatever, that's going to represent medical. I think Dr. Oz is representing Medicaid, and Medicare, which he doesn't have Medicare experience, but he's a TV personality. So it's just like you can't really make this up when it comes to American politics and healthcare, especially. It's like those things just go hand in hand in some type of comedic show, like it should be a show on Netflix or something. So yeah, you can't make this up. So yes, we talked about staffing and hospitals and long-term care facilities lying about their hiring process and staffing. We talked about CNAs being discriminated from a nurse's station, which is crazy, if you ask me. And we also talked about Congresswoman in a nursing home that was getting paid. Like I said, you can't make this stuff up. So anyway, this is your Wakanda RN. I love you guys. Thank you for tuning in to the show.
If you like any of the content, please feel free to like, comment, or subscribe. If you want to continue to donate to the channel, you are more than welcome to. Your donations go a long way. Give me a follow on Instagram, TikTok, and YouTube. Much love. Thank you.